Hello, my name is Barbara Markham. I'm the Director of the Senior Resources Department, City of Westland. With me today is Moccia, who is the Program Coordinator and Nurse Practitioner at St. Mary Mercy Hospital. The center has had a wonderful relationship with St. Mary's, and we have started a program through the mayor, Your Journey to Better Health. So you've been a guest at the Friendship Center and met a lot of the seniors. Yes. And so we've been building over the past year a wonderful relationship with your hospital. While you were there, we were talking about a wonderful new program that you have at St. Mary, and I would love you to tell our viewers all about the new senior emergency room.
Well, I'm very grateful and honored that you asked, us to be here today. And the Senior Center, how did it come about? Just a little history. One of our sister hospitals in Silver Springs, Maryland, Holy Cross Hospital, the CEO there, Kevin Sexton, had his mother go to an emergency center. And with all the chaos and the loud noise, and he had that experience, and his mother had that experience, and he came back and he challenged his team to say, maybe we should create a different environment for our older population. So they went ahead and they looked at the design of their emergency center, and they went ahead and changed it, and worked with a nurse practitioner, Susan Smith. And then he came to the Trinity Health conference that we have yearly in Chicago, and spoke to all the other CEOs across the ministry organization and talked about this concept that was very much embraced by the public and the community. So Dave Spivey, our CEO, came back to us at the emergency center and spoke to our director, Karen Bostic, in the ER and said, I would like to do this, for our older population. So we looked around the emergency center and said this might be an ideal area in our ER to be able to design for our senior population. So construction began. We were very fortunate. We had 6 beds in our senior emergency center that are all private rooms, and they had windows, which is very nice to get that natural lighting. Mm-hmm. So what we started to do is the physical enhancements, and we put in non-skid floors, non-glare, changed the coloring, really nice, soft, neutral hues. We got dim lightings. We also enhance visual, because as we get older, we have vision impairment, hearing impairment. So we went ahead and put large clocks in. We also had page magnifiers for some of us who might forget your reading glasses when you come in. And then we also know, because of some hearing impairment, that you may not hear us, and we don't want to be screaming, you don't want to be screaming at us, so we went ahead and we received a pocket talker, and actually we did receive that from a donation from Sound Advice, that went ahead and was so interested in our concept, said we'd like to do that for you. So we changed the physical enhancements, and if you walk into that area, as one of our nurses would explain it to you, it's our sacred space.
I've heard the environment is wonderful.
It's just beautiful, and like Jennifer Matson, one of our nurses that work in the emergency center, she says when she walks in there, she feels this sereneness that comes over you, and it is so positive when you walk in that area, because when you think about the traditional emergency center, it is very loud, it's very chaotic, there's phones ringing, there's EMS drivers coming in with patients, it's very loud. That can very disturb as we get older. So this emergency center that's only a few steps away from our main area and from our observation areas, in a much quieter environment, and it allows us to have these conversations with patients with not all this hustle bustle.
As seniors get older, that chaotic environment that you were speaking about, you're right, is very unsettling. So it's nice that they can feel relaxed and not shaken up. I mean, it's bad enough to have to go to an emergency room. What kind of cases and under what circumstances do people come to the emergency room, and you know, with the age of what we call a senior is different in every area and for different organizations. How old do you have to be to receive the services at the Senior Emergency Center?
Well, the Senior Emergency Center is actually designed for patients that are age 65 years of age or greater, and that's also because of, you know, as our aging population, that takes up about 12.5% of our population.
And growing.
Yes, exactly, as we're growing, as I know I'm coloring my hair all the time. So it's designed typically for that age of patient, 65 years of age or greater, to go in the Senior Emergency Center. And also to be able to come into that environment, because we do base, when you come to emergency center, we call triage. It's called to sort patients, and we work on the emergency severity index levels from 1 to 5. If you have a very high acuity, like you have a compromise in your airway or breathing or circulation or something, you're having an active stroke or an active MI, heart attack, those patients will stay up in the main area. So we're seeing patients that still have chronic illness, that are having complaints of pain. The urgency is still there, but it's not an acute emergency. So those are the patients that would be candidates to coming back to the senior center. But I do want to let everybody know, your viewers, whether or not, because we're a 6-bed unit, and it's
going to ask.
It's very popular, and whether or not you can make it back to that part of the emergency center, that every single patient that comes in that's age 65 years of age or greater will still receive the same essential screenings and tools that we're using now. We have captured so many unrecognized and unmet needs in the population as we grow older that were not recognized before, because the screenings that we're doing now, you can't capture by a medical surgical history. You can't capture that. I mean, we're talking to people, do you have difficulty ambulating? Have you had a history of falls? When we're looking at their medications, and if they're on any high-risk medications now that alert us, we fax that to pharmacy so they become involved. And we're having conversations with the older people, and some people don't even realize that they'll give us their home medications, and we'll say, do you take any over-the-counter meds? And they'll say no, and they'll say, do you take anything, how is your sleeping patterns? And they say, oh, don't worry, I just take some Tylenol PM. They don't realize that in Tylenol PM is Benadryl. That's what's actually helping you sleep, but that also can cause you to become over-sedated, can cause you to become dizzy.
Especially if there's another medication involved, a pain medication or something.
You know that, Barbara, and then they can go ahead and they can fall, and that increases them at fall risk. And that is when you fall as you get older, all the injuries that you can sustain, from lung contusions to a hip fracture to a humerus fracture. How about that patient that's on Coumadin and now they fall and they hit their head? They can have subdural hematoma. So there's so many things that can happen. And so these conversations, these tools that we're using, we're finding things about people and engaging in conversations. And being in this sacred space that the team is just so excellent, and the whole ER staff, is that we're finding things about people and reconnecting with that spirit.
Well, as seniors get older, their problems are multifaceted.
Absolutely.
And so their care, it's common sense that the care would have to be multifaceted too. And through the traditional emergency room, they tend to treat the illness, but you're right. They overlook some of the things that are involved, especially maybe some things like their living situation, their functional ability versus, where they're living. So I think it's wonderful and absolutely necessary. So what happens? Somebody comes in and they have a problem, and you treat them multidimensionally.
Correct.
What do you look at? How many different people are involved? Do you have like a team that looks looks at a patient and their needs?
Well, certainly, every patient that will come in will have their ER physician or nurse practitioner, or we also have physician assistants that work in our emergency center, and they'll have a primary care nurse that will also assess their needs, and of course we have emergency room techs that also help us too. And then when we're doing this needs assessment, that's where we find out that maybe they might have something they need some assistance with their activities of daily living. Like we really ask them, can you mobilize? Can you walk real well?
Can you prepare a meal?
Exactly.
Can you brush your teeth?
Exactly.
Can you use the bathroom?
Can you clothe yourself?
Yes.
Can you do those things? And then that's where some conversation starts to begin, and we're finding out about people. And then we have a social worker now. We've never had a social worker in our emergency center. And I know you're going to be following up with that segment. And she is awesome, Kathy. And she is our resource. We're able to go to her now because we're finding all these things about patients at their needs, that she is a wealth of knowledge, and she knows all these resources that are out there that we can get patients. I mean, and I don't want to steal her thunder because you're going to be talking to her, but we knew within the first few hours that we opened up that senior emergency center what she could offer them. We knew there was no turning back.
Wonderful.
We found so many things in the resources that we didn't even know about, and all the things that we're learning about. And when you talk to the emergency room nurses or the techs or the clerks or the physicians, and what we've learned from Kathy, that all the resources, only we wish we would have known for our parents. And so many people have said that, and that we're now able to offer people so much more.
Which is wonderful. Now, it's located then in the area of the regular emergency room.
Correct.
And you have 6 beds.
Correct.
Is there a nurse's station that oversees those 6 beds?
Yes.
Okay.
That is a separate area. And when you walk in, it's separated. It's much quieter. The nurse's station's right there. We can see the beds that are around us. And I'm glad you asked me that again, because the need is so great that now we have another section in our emergency center that actually has 5 private rooms, and we're going to be changing those now. And doing all the senior enhancement, the clinical enhancements, the physical enhancements in that area also. So we're also going to have 5 other beds now.
Well, I can see just from the beginning of this that you're going to need them. I think this is going to be a very, very popular program. I think it's very needed, and I'm so glad that St. Mary address this, because I'm excited to see where this is going, and I think I'm curious a little bit about the feedback. There have been how many patients in and out of the hospital? What kind of feedback have you received?
We opened on July 14th, and we've had, and I can only tell you up for about 3 months, not for this month now, but there has been about 11,000 patients that came through our emergency center, ages 65 years of age or greater. We have a large population of seniors that come and visit us for a variety of reasons. And since that time, for about the first 3 months, we've had 1/3 of that, so about 3,600 patients that's actually came, and that volume continues to grow. We're seeing a lot more patients in that senior emergency center that have had that senior care experience. So as you can see, there is a need.
Yes.
We're going to need more. We're going to need more beds, and also we're receiving phone calls now. We haven't even advertised.
I know that.
We haven't even advertised. It's all been word of mouth. And people calling in saying, is there a bed in the senior ER? Can I get in there? We have doctors writing on prescription pads. I want my patient to go to the senior emergency center. And we're all sensitive to that. So again, if the patient can't make it in there, they're still going to receive the same screening tools that we do. And they're still going to be able to see Kathy, our social worker, if there's any needs for them that we discover.
Do you have geriatricians that work with seniors?
Yes, we do. We have board-certified geriatricians that work on our staff, and our emergency center physicians have taken extra courses and modules on taking care of the older patients. Because even as nurses, and I've been a nurse for 35 years, that even though I've had experience and I've worked with patients of all ages. There's a special education that we also need. So what we did is we went on the Emergency Nurses Association site, and they have recognized as long as pediatrics are a special population,
yes,
so is the older population. So they created an 8-hour self-study module. So all of our nurses took the 8-hour self-study module. Our ER physicians did some extra training on that, and we continue to be educated as we age how our needs change.
And they do change dramatically. You know, it's when, and I have the utmost respect for doctors and nurses. You know, when pharmaceutical companies test medications, they test them on 40-year-old males.
Exactly.
You know, as we get older, and there is sometimes a degree of toxicity that is, you know, in the older adult population, and the same amount of drug for a 40-year-old male may not be what an 80-year-old female should be taking. So I think it's wonderful that you have an area of expertise where senior citizens are involved, because we are talking a different ballgame.
Exactly, and as we age too, our kidney functions and our liver function isn't as good. And as you were saying, all those drug interactions that occur, and you're looking at those lab values, looking back, like as your primary care physician or the ER physician, nurse practitioner, physician assistant, going back, because you know we're all computerized charting now,
yes,
which is great, because you used to have to call and say, could you bring me their old chart up? We don't have to do that. We can look in the computer if you've had visits before. So we can go backwards in time and say to Mr. or Mrs. Smith, we can see that your kidney function is decreasing a little bit more, or your liver function. Now we're going to be looking at these medications. So what you were taking before, maybe we need to lower the dose a little bit. So that's wonderful now with having the computerized charting too, that we're able to access information.
See a little bit of history there.
It's excellent. All of that's in there, and it's great because if you're allergic to something, and if you put something in, it'll come up and say that you're allergic. So we're very, very lucky having a computerized system. And also I'd like to say that all of the Southeast Michigan Trinity Health hospitals are going live with the Senior Emergency Center, and Chelsea going live November 15th, and then we have the last two, Brighton and Livingston, they'll be going live in December, because St. Joe Mercy Oakland's already live, St. Joe Mercy, we have Chelsea's going to be, Saline, so, and we're very fortunate. So as our President of Trinity Health has said, it's for every patient, every time, at every location.
Wonderful.
So it's huge.
Is this open 24 hours a day?
Yes.
Wonderful. And there's staffing 24 hours a day?
Yes, and we do have a core team, but all the emergency center nurses can also go in there too. And we stay open. So if a patient needs to be in that area.
We know emergencies happen all hours of the day, up to go to the bathroom at 3 o'clock in the morning in a fall, and you know
that's not uncommon. That's not uncommon. And the beauty of it also is too. Let's say that you do come in some difficulty breathing, and we feel that you need to stay more up in the front area than coming back to the Senior Emergency Center. Even though we still have the emergency equipment back there, it's full service. We can take care of an emergency back there, and that's already happened on a couple different occasions. That once you start feeling better and you're more stabilized, we'll have a conversation with you, and we'll say, hey, Mary or Joe, we have a bed in the Senior Emergency Center. Would you like to go back in that area? It's a little bit quieter, it's more subdued. Would you like to go there? And the reason why we ask, because maybe Mary or Joe has already partnered, let's say it's Edie, their nurse, and say, but is Edie coming with me? And we'll say, well, no, Edie's working up in this area. If they've already partnered with that nurse and they've already established a relationship, then they'll stay in that area.
Right.
We do have the conversation with them, because we don't want to disrupt that connection that they've already had and change them in another area. So we do have that conversation, but as soon as they stabilize, we have a bed in there. We're right there. That core team is always watching, looking at all the pulse of the emergency center, saying, well, they'll go out and they say, can we take Mrs. Smith from you, or can we bring them back so they can enjoy the senior experience? It's a wonderful team. We have a great team.
I think it's wonderful, especially when you said they partner up with the nurse, because so often it's a traumatic experience, and once they establish that trusting relationship, it's important that that's able to be followed through. So I think that's wonderful. And I want to thank you so much for being on the show today. And we'll be talking with your social work department, but it's been a pleasure working with you at the center. I really am excited that this information is getting out to the community, and a thumbs up. I just think it's wonderful. So thank you so much.
Well, we feel like we're living up to our mission, that's for sure.
Well, thank you, Michelle, for being with us today.
Thank you.